Welcome to the Fit Chicks and Hormones podcast, where we focus on all things midlife, hormones, and how to finally feel good in your body again. I'm Angie, a fellow midlife survivor, here to help you stop guessing and finally get results with hormone smart habits that actually work. Let's get started. Hello, everyone. Welcome back to the Fit Chicks and Hormone podcast. I'm Angie Marone, your host, and today I'm talking with Stacey Roberts, who is a pain specialist, a physical therapist, and a functional medicine expert who has written a book called Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections, which sounds amazing. Yeah. In her 30 years of working with patients, she's discovered that many women in their 40s and 50s are literally eating their way into chronic pain. I'm finding this out a lot too as I'm working with women. So if you've been told that your aches and pains are just part of aging, today's episode is going to be very eye-opening for you. So we're going to dive into the connection between food sensitivities, joint pain, and how hormonal changes that you're experiencing might be making certain foods trigger inflammation in ways they never did before. So Stacey, welcome to the show.
Thank you so much for having me. I'm so excited about this podcast.
Yeah, this is definitely something that I think women don't relate to they have a lot of it going on, but they're just like, oh, it's just getting old. My body's just achy and pain, all this is going on because I'm just getting older, which in a sense, okay, it's happening, but there's so many things that are adding to it. So let's just backtrack a little bit and just have you start with what inspired you to focus on something like this, like helping people live pain-free without things like surgery and drugs and things like that.
So as a physical therapist of over 35 years, I've always done that in my, career. And we've kind of gotten away from the way it used to be. That used to be you go to physical therapy and then people put their hands on you and you get stronger and you look at your biomechanics. And we've gotten away from that for many reasons. In particular, insurance reimbursement's gone down. So now it's all about just get them in and exercise, get them out, get as many people as possible, especially in the bigger chains. So physical therapy has changed, but also we've moved, and since 1990 when I graduated, we've moved more to I'm going to take a pill for my pain society. We've really been conditioned to do that because it works quickly. But what we don't realize, and I talk about in the pain-free formula, is that those pills actually can set us up for chronic pain and actually make us hurt more when they wear off. So, and nobody's telling us that, right? And then, what really, really made me write this book was my own personal experience. It was in my 50s. I go to a wedding. I see my son trying to do the polka at a wedding. And I'm like, oh boy. And at that time, he was like 21, 22. So I thought, I'll go out there and show him, right? So I get out there and we start doing the polka. And after this incident, I'm like, there should be warning signs on weddings about if you're over 50, weddings can be very dangerous. So I had a big pop in my knee. It just went pop, and I put some weight on it and searing. It felt like somebody stuck a knife in between the two bones of my knee. And my son's like, oh my God, what's going on? Because a tear was coming down my face. I'm like, no, I'm good. So I come off of the dance floor. My knee doubles in size. It's just so swollen. I don't even know how I got back to the hotel. I kind of dragged myself into the car, had to drive with my other foot, all those things. And then I have a device called SoftWave in my clinic that significantly reduced the inflammation. I knew what to do from an exercise point of view. So within like 3 SoftWave treatments, I was back off crutches and walking again. But I wanted to know what that pop was. Like my brain was like, what was that? Like I couldn't tell exactly if it was scar tissue from a surgery I had 30 years prior. So I went to the doctor and I was like, okay, I thought we'd have a great conversation as colleagues. But I really also did just want to be the patient. I just wanted to sit back and be like, okay, help me, learn what this mysterious pop was. And when they put up my x-rays and I had my MRI done, the doctor didn't even really say anything except for you have a ton of arthritis in your knee, you need a knee replacement. And I was like, wait, what? Because I didn't have any pain in my knee. I had surgery in that knee 35 years prior, but I had not had pain in my knee up until that pop. But I could see the arthritis, right? So what I realized then and there is that you can have a ton of arthritis in your body and your joints and not have any pain, because I didn't for years until this happened. So then they said, well, the only other thing we can offer you if you don't want to do surgery, and mind you, they didn't even offer me physical therapy, and they didn't even see that I'm a physical therapist, right? I just thought that was such a disconnect, right?
Oh, so frustrating.
Yeah. And then, so they go, the only thing we can offer you is a cortisone injection. And I said, no, thanks. And she said, do you mind if I ask you why? And I thought, well, she asked, right? I was really trying not to, be that person. And I said, well, all the studies are showing, really good evidence that cortisone is just going to deteriorate my knee more, cause more inflammation, more degeneration. So why would I want to put that in that knee? And I pointed at the X-ray, and she's like, "Oh, you'd have to have 100 of those shots in order for that to happen." And then I was fuming because I thought to myself, how many other people are
Mhm.
hearing that same thing and getting the wrong information and setting themselves up for surgery that they may not have even needed, right?
Right.
So that's what really primed me to really focus, and probably in the last 10 years I've been focusing more on hormones and food sensitivities and gut health with pain, just because I've been seeing it in myself and then I've seen it in my friends and seeing it in my patients. So that's why I wanted to put it all together as not just a physical therapy book, but a book that really is functional about functional medicine and looks at the whole person, what all the different things are that we could be doing and that are causing our pain and what we can do about it.
Right. And I absolutely love that. I love that because, right, instead of looking at one thing, let's look at all
Yeah.
the things, see what's going on because there is so much going on, especially as women are going into our later years and things are shifting, our hormones are changing, and again, just the education part that we can do through the book, through these podcasts, whatever, women can learn more. And then they're going to have the knowledge when they go in and somebody says, do you want a cortisone shot? Do you want surgery? They can be like,
Yeah.
well, no, what else could we do instead? So,
Right.
um, what is it with the hormones that you feel are during perimenopause and menopause that make women more susceptible to food sensitivities and joint pain?
So what I knew based on my training over the years is that when we start to lose our estrogen, progesterone, and perimenopause, and then into menopause, I knew that that changed the elasticity of our soft tissue, our joints, our tendons, even our ligaments, even like the fascia on the bottom of our foot and fascia in our body. It just isn't as elastic as what it would typically be. If you bring a rubber band out to its full length and then let it go, it just snaps back. That's what our fascia and all the other soft tissue should be doing. But as we age and we lose some of the estrogen progesterone, that we get less and less of that, especially if we're dehydrated or if we're not eating foods that are, if we don't have a good anti-inflammatory diet. But what I really found when I dug into the research, and I kind of knew this intuitively, but I don't think everybody really puts it together, is estrogen, progesterone, estrogen especially gets a bad rap, but when they are in their, what I call the Goldilocks levels, right? The just right levels for us, they're anti-inflammatory. So they help us fight inflammation for decades of our lives. So then as we go into those years where we're having less and less of them, we lose our protectors or we lose some of our protectors, right? So if things that we were doing, whether it was drinking alcohol or eating certain foods or not exercising, all those things that may have contributed to inflammation in our body, our estrogen progesterone was helping protect us from really feeling that or having to deal with it. Now we lose some of that protection, and that just bubbles up to the surface because we're not changing our habits as a result. We're typically taking pills for years, right, to address previous pain. I'm not against medication. I want to state that. I'm just against the overuse of and then the lack of education about medication so that we can all make our own decisions about what we want to do. So that's really when I started digging into it for the book, it really opened my eyes that, even cortisol, which again gets a bad rep as the bad stress hormone, that is anti-inflammatory at normal levels. But if it's too high, like if estrogen's too high, then it can be pro-inflammatory. But if they're both too low, we lose some of that protection as well too.
Right. Yeah. Yeah. It's funny because I find women, they hit their 40s and all of a sudden I'm not doing anything different, but
Right.
my body hurts so much. I can barely get out of bed. I can't walk. My knees hurt. My feet hurt. And I'm like, yeah, we need to take a step back and look at what are you doing now? Because maybe all those things you were doing before, they're just not serving your body right now. Right. And this is
Correct.
one thing that I really talk a lot about is like food sensitivities because I could eat a lot of the foods when in my 20s, but now I'm like, it's just, it does, I notice right away. I have brain fog. I can't think. I don't sleep. My body just hurts. My hips hurt. And uh, it's, again, something that I was able to eat before, but now I'm like, it's just not worth it to me because I don't like feeling that way. And I think having women realize, first of all, pay attention to your body, right? Listen, your
Mhm.
body's going to tell you.
It sure is.
Yeah, and so what do you feel, or what have you come across? Like, what do you feel are the top three, four most commonly trigger foods when it comes to joint pain?
Well, I think the ones that we all kind of know about right away, right? But we still kind of sneak in our diet because we're like, it's my only vice, right? So things like ultra processed foods, okay,
Mhm.
things that are in a box, things that when you look at the ingredient list, you could barely pronounce anything that's in it, right? So anything that's really not whole foods and that's ultra processed, that is going to be inflammatory. We know our artificial sweeteners, more and more is coming out about artificial sweeteners being inflammatory. And there's a ton of those in things like sodas and soft drinks and all that type of stuff. So those would be like the big three, like ultra processed foods, sodas and soft drinks, and then artificial sweeteners pretty much in anything. Now, a lot of us know that, and we may occasionally have those things, once in a while. That's usually not the problem. But I'm
Mhm.
seeing a lot of women who are working really hard. They're working really hard to get away from those things, and they've removed a lot of those things from their diet. And yes, their inflammation has come down. And I'll be honest, I sailed through menopause with minimal to no symptoms until I got to like my mid to late 50s now. And then my joints started to really bother me. And that was really my sign of, oh, okay, my estrogen progesterone really must be bottoming out now. But because I made the diet changes early on, like in my 40s, because of, other issues, constipation, things like that, that really, really helped me through menopause. I was able to optimize my gut health so I wasn't experiencing hot flashes, sleep issues, vaginal dryness, all those things that we typically hear about. But we don't really hear about joint pain. And so we
Mhm.
don't think of it connected to menopause. But really, some of the studies show that it's more common than hot flashes, right?
Mhm. Mhm.
So that's really, when I look at it from the standpoint of, how hormones are impacting us. I mean, I remember one time I'm literally sitting in my office up front with my wonderful office manager. And I was just typing on the computer and I had started a new arm workout, like upper body workout, probably 2 or 3 weeks before. And all of a sudden, just sitting there, my shoulder just went crack and it just dropped. And I was like, what was that? My office manager was like, oh my God, what is that noise?
Wow.
And it was just again, I tore my rotator cuff. Just basically had been doing these exercises, and I'm a physical therapist, and I was still doing it, and ended up hurting myself, right? So, but that's the elasticity of those soft tissues weren't enough for me. So then I had to look at what are my other things that I can do to beef up my what I have left of estrogen progesterone to be anti-inflammatory as best as possible.
Yeah. Yeah, I love that. I love that. And I want to go back to the shoulder thing because I'm finding a lot with the women that I work with in my fitness studio, and women are telling me that frozen shoulder is so much more common now. And they're like, oh, I injured myself. And I'm like, you probably did. We probably overdid it, but it's not because there was something mechanically wrong with you. It's because your hormones. And what do you find that with that is, and do you feel women are learning more about that, or are they just coming in with like shoulder pain?
Yeah, I mean, I've seen frozen shoulder forever. Like, I've always seen it, and I knew kind of early on that it was due to, or could be due to autoimmune issues. So if a person is starting to develop autoimmune issues like Hashimoto's, that's been correlated with the adhesive capsulitis or frozen shoulder. So I always would tick that box, check that off to see if that was the issue. But even one thing that a lot of people don't know, and I'm not anti-vax, so don't everybody jump on me for this, but in nursing school, when we were taught how to do vaccinations, we weren't taught anything about the joint capsule. So the joint capsule is this balloon that surrounds the capsule that keeps the synovial fluid in there and safe and keeps the lubrication in our joints. If that capsule is pierced because you did the vaccine incorrectly, that can set you up for a shoulder injury down the road. And a lot of women were coming in post-vaccination, especially around COVID when a lot more people were getting the
Yep.
vaccinations as an adult and having frozen shoulders. So that can be an issue as well. And then to your point, trauma, right? So I see patients who've had rotator cuff surgery and, maybe their body is generally inflamed anyway, then that contributes to them developing a frozen shoulder as well too. So there's definitely different things that contribute, and the hormone changes that we have through menopause are one of those things that can exacerbate all those things I just talked about.
Yeah. And like a lot of it is coming back to the inflammation part of it. It's just like
Hmm.
your body just being in chronic inflammation and
Hmm.
without feeling it. So even sometimes you
Right.
don't even know that it's there, right?
Yeah.
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 I think a lot of times with that is, and patients will say this to me, especially when they go through their functional medicine, is they're like, wow, I didn't realize how inflamed I was. Like, it's just kind of the baseline that you get used to, right? Because you go to the doctor and they're like, oh, it's just because you're getting, you're in your 50s, you're just getting out. So we just kind of accept it. And then once they go through the program and the inflammation decreases and they're like, oh my gosh, this is how it is to sleep, and this is how it is to have energy, and this is how it is to be able to go and play and not be so sore. So I think, that's a big part of it as well too.
Right, right. Again, it all goes back to that body awareness. We may not even really feel it, but when you take action to do the things, then you're like, oh, this is a whole new world that I can
Yeah,
live in. I just do these things. So,
exactly.
yeah, that's
Exactly.
awesome. Uh, so let's say, because you talked about your experience or whatever, somebody is having joint pain. This is going on. Maybe they've hurt something, or there's just, they're just achy and they're thinking, oh, I need a medication or I need something quick to help fix it. What would you suggest? Like what steps should they take? Where should they start first and then go from there to start feeling better?
Well, before they go and see anybody, if they've had an injury or feel, inflammation or soreness or achiness or things are aching at night, instead of popping a pill to mask it, because that's our body telling us there's something going on. And that, again, as we alluded to earlier, doing that too often it can increase our pain sensitivity, meaning our pain threshold decreases. So what we would have been able to tolerate before and wasn't really painful is now much more painful. Also sets us up for chronic pain as well too. So really getting away from that habit that's ingrained in us to go, okay, I'm going to take this pill to get rid of it, and just put a little ice on it, rest it, all the things that we know and in our lifestyles today are not as easy to do as they were maybe, 20, 30, 40, 50 years ago. But start there, right? Put some ice on it, see if you can get the inflammation down. And then if that stuff persists, and the ice doesn't have to be really long. I mean, we're getting away from icing for long periods of time. And I'm talking like 5 or 10 minutes, right? If that pain then continues to persist, then go see somebody. And you want to see somebody like a physical therapist who actually still looks at the way that you move, still looks at the way that you walk, still looks at your biomechanics. That's basically how our joints move in our body. So they can assess and say, oh, okay, it looks like you have an impingement in that shoulder because this muscle's weak and this one's tight, and we need to stabilize this and do these couple very personalized exercises, not just a sheet that everybody gets when they walk in the room, but very personalized exercise to your situation. And do that as soon as you can if you're able to get into somebody like that. If they're not putting their hands on you, then you need to look someplace else, right? You need to find somebody who's really going to take care and not just worried about, getting as many people in an hour as possible. And unfortunately, some of the chains are like that these days. So then let's say if that doesn't work, then you're going to be looking at going to your orthopedic to get a little bit more information. But in the meantime, ask yourself, okay, well, what does it always hurt like every night? I go to sleep, and if not, on the nights that it does hurt, what did I eat? What did I eat or drink that night that might have really, revved up the inflammation, right? What are my mechanics like when I'm sleeping? Is my arm twisted behind my head and all in all different areas?
Right.
So lots of things that we can do to really just suss out what's going on. But because we cover it up so much and for so long with the medication, it sets us up for further injury. And then it's a lot more difficult, to get back, or the chronic pain cycle is a lot more difficult to get out of, and especially if we're not assessing our diet and our hormones and things like that. So that's kind of, then the next step is looking for somebody with functional medicine that can look at all those things. And I'm lucky I can do all that, being a nurse and a physical therapist and with my background as well. So that, I guess that's kind of the path that I would take. You don't have to jump right into spending hundreds of dollars on stuff right away, if you don't need that. And you can do some of those simple things first.
Hey there. Let me guess. You've been doing all the things you used to do, but suddenly your body just isn't responding anymore.
the weight's not budging, you wake up feeling tired, even after a full night's sleep, your stomach feels bloated by the end of the day, and honestly, you just don't even feel like yourself anymore. And I get it. This stage of life, whether it's in perimenopause, menopause, or beyond, it can feel like your body has turned against you. But here's the thing. Your body isn't broken. You just need a new approach that actually works with your hormones, not against them. And this is exactly what I help women do in my 3-month midlife makeover program. This isn't about crash dieting, endless cardio. Instead, we focus on rebuilding your energy, balancing your hormones through nutrition and lifestyle, and creating strength in your body, which is going to help you to feel confident in your skin again. What makes this different is that it's not a one-size-fits-all plan. We work together to create a lifestyle that actually fits into your life and works at any stage of menopause. Because, let's be real, life is not going to stop just because your hormones are shifting. So if you're ready to stop fighting your body and finally start feeling like yourself again, feeling lighter and stronger, full of energy, I'd love to walk this journey with you. Click the link in the show notes to learn more about the Midlife Makeover Program. Your best years don't have to be behind you. This is just the beginning.
Right. And two things from there. First of all, like you kind of mentioned, if you feel like you're not getting the answers that you want, or somebody's just saying, just take this and it'll be fine, look somewhere, get, that's not the answer. Again, there's always underlying causes. This is what frustrates me too. Like when I go, my foot's hurting, they're like, oh, well, just take this and it'll make, I'm like, but that's not telling me why it's hurting. I want to know what's, what's going on with it
Right.
versus just covering it up, because then it's going to continue on. And like you said, get worse, get like could cause further injury or whatever's going on. So first of all, take a step, and listen and want to educate yourself. And then I forgot what the second thing was. This is menopause brain, right?
It'll come back to you.
um, let's talk about your book a little bit, because I want you to talk about that, things that maybe we didn't talk about. You know, for one, these women that want to eliminate the pain, we just talked about all the steps, whatever. What more could they find in that book? Like, what kind of things did you touch base on that? I assume educational, because that's what, the more we know, the more women know, the more people know about their bodies, the better they can take action. So, if you'd love to just give us a little bit
Sure.
over that book, that would be wonderful.
Sure. So the first half of the book is really how conventional medicine treats pain now. And if that's not working for you, the second half of the book is what you can do instead if that hasn't worked for you. Like we talk about, again, I won't beat it like a dead horse, but the NSAIDs and the anti-inflammatories and pain meds and all that, how that can actually set you up for having more pain in the long run. So we talk about that. I also talk about, surgeries that you may, I think I can't remember if it's 1/3 or 2/3, either it's a lot of surgeries that in the Journal of American Medical Association back in 2014 said were unnecessary joint replacements. So things like, so we talk about that again, just to bring awareness, not to make you feel bad, just to bring awareness. And then the second half of the book talks about what you can do instead. We mentioned estrogen, progesterone, so getting those levels checked, seeing where you're at with that, but also thyroid hormone is really important. Because thyroid, when it's out of whack, you can have muscle and more muscle pain typically than joint pain, but you can have both when the thyroid's not right. And, if you're feeling tired and you have low iron and you have muscle pain and you're constipated and you're losing your hair and you go get your thyroid checked and you're gaining weight and they say, oh, your thyroid's fine, then you need to go to somebody that's going to look at more detail about your thyroid, not just one or two hormones. You want to look at all the different things that are impacting the thyroid. Cortisol, we mentioned briefly, estrogen, progesterone. So looking at all those hormones. And I like to do urine tests to see how the body's processing those hormones, looking at the metabolites of the hormones, which basically are, if estrogen is a Lego house, like a house made of Legos, each of those Legos is a metabolite of estrogen. So we want to see how the body's getting rid of it or holding on to it. How is it processing those hormones? And then we briefly mentioned food sensitivities. So I'd love to go into that a little bit deeper and start working on gut health. Because that will significantly reduce inflammation generally in our system and specifically in our joints. There's modalities that you can use. I have SoftWave in my clinic, which I mentioned before. So that's, if you seek out someone who has SoftWave, that can help as well. And then we talk about how the brain changes when we have chronic pain and what you can do to stop that pattern. And because at any age we have neuroplasticity in the brain, so we can change these patterns in the brain. We don't have to be kind of set in our ways, right? We can change that constant chronic pain cycle, which again, same type of thing. When our brain tries to overprotect us, it makes us hurt more, even with doing small things. So that means that we stop doing them, and then if you don't move, you lose more range of motion. If you don't use it, you lose it. Motion is motion. So if you're not lubricating your joints, you're setting yourself up for more pain. So it goes through all those things and tells stories about patients that have gone through it. And you know, some start from the beginning of the book and go all the way through to the end. And then some of the chapters I give full stories about people that, and a lot of people have said to me, I can see myself. It's like you were talking to me, or it's like I was the person. A couple of my friends, I had to argue with them. I'm like, that is not you in the book. They're like, I swear that was me that you were talking about. And I'm like, no, it honestly wasn't you. So I hope that my hope is that it speaks to people that are, you know, experiencing pain, and that they can find a solution within it.
Right. I love that. I love that. Oh my gosh. I know some clients that I would love to give this book to. So
Thank you.
yeah.
Thank you.
Yeah. I mean, because again, even though, you know, I mainly work women, hormones, physical part, there's so many parts. There's so many things. And um, I find that the physical part, like the movement part, when we're in pain, like you said, we don't want to move. We don't want to do the
Mhm.
things, but that's the worst thing you can do. Even though I know it's painful, it could be or uncomfortable, but like making sure, then let's figure out why that's uncomfortable. Let's figure, you know, is it because you're eating too many inflammatory foods? Is it because you're not moving enough? Is it your hormones? Is it your gut? Like there's so many
Yeah.
pieces. I love that you go into all of the things.
And
That's
some are just so small. Like yesterday, I've seen a patient she's had knee pain for so long, going up and down stairs, and she's only in her 40s, and she's taking the stairs, you know, like she's 89 years old, like one at a time, kind of sidestepping it. And when I watched her do it, I was like, okay, just try to put the weight on this part of your foot when you go up the stairs and down the stairs instead of what you're doing. And she's like, oh my God, it doesn't hurt. I'm like, yeah, but she had for now 3 years had been doing all that she was scared to try anything new. So just taking her through that for 2 or 3 minutes of my time was able to help her go, oh, okay, I can move a little bit differently, and then I can move safely, right? I'm not going to have pain. And the last time I saw her, I think it was yesterday and the time before, we talked about it, and she was going up and down the stairs with no pain, as long as she paid attention to that. So sometimes
that's
it's just a small tweak.
right, right. And you learn those patterns of I'm uncomfortable, so I'm going to walk this way because it makes it
Right.
feel a little bit better. And then that eventually causes more pain and more issues
Yeah.
and more things. And then we get in pain. It's like a cycle. And then we are in pain, and then we want to eat the bad food because it makes us feel better. It's like
Yes. Hmm.
it's
Exactly.
not just physical, it's emotional too that, you know, causes all the problems as well. Um,
100%.
yeah, and I remember what I was going to say now.
I
Is
knew it
about
would come back to you. Yeah.
no, is that it's so easy for us to just give me something to make me feel better right now because we are busy, because we have so much going on. But in doing that, you're covering up things up. You're not actually making a lifestyle change or a lifestyle adjustment that's going to help you to feel better for many years instead of just temporarily for a couple months or a year maybe. And then it's again, um, then that's the one thing I want to just, because a lot of people will come to me too, like, what supplement can I take to this? I'm like, well, let's start. I want you to go for a walk and I want you to eat right now. They're like, that's not a supplement. I'm like, you're right, but it is. It's better than that supplement. You know, let's start there. Um,
Hmm.
do you find at all with that, is that a pushback for you? People are like, well, I just want something right now to just make me feel better. Right.
Yes. Yeah. So a lot of times I'm educating people about the medications and what their the side effects that nobody talks about are. So then they start to think, oh, I knew it wasn't good for my kidneys or my liver, but I didn't really think about all the other stuff that it could do. So then they start to decrease that for sure. But they then want the other pill that's going to help them through a supplement, right? So then I'll have patients come in with literally, and I'm not exaggerating, a bucket full of supplements that they're taking that has, A, B, C, D, all in separate things. And then, switching from this to this, and they don't really know what to do. So we spend a lot of time streamlining and getting rid of supplements.
Mm.
And for those people who don't like taking any pills, sometimes the supplements that we do give, they're like, oh, that's a lot. But I go, okay, we're streamline it for this specific purpose. And it just, I'd rather take, some supplements and not have to take 15 medications like I'm seeing a lot of elderly patients being prescribed. So if I can move away from that, then and the supplements need to be good quality. There's so much that goes into that. But to your point, it's really important that we educate about, what to do even before that, right? Because we want the supplements to supplement a healthy lifestyle. We don't want to get into that same habit of, oh, the supplement's gonna, be the cure all, right? It's nutrition for the body, but it's not going to take place of movement. It's not going to take place of exercise or eating right. As a matter of fact, it can, be a problem if you eat poorly or smoke and then take fish oil, for example. It's
Right.
not great. It can oxidize and be a problem. So yeah, I agree. I think there's two sides of the coin, people who are taking way too much, people who aren't taking enough and don't want to take anything. And I think we can meet them right in the middle, but it's got to be a holistic program.
And I feel that for me personally, like if I have something going on and I want to address it, to take the steps and figure it out, for me that's empowering. I'm doing this. You know what? I just did this myself instead of I just took a pill, I just took a supplement and that made it go away. No, I figured this out and now I know how my body feels and now I know what to do to make my body continue feeling better. I think it's empowering for women and it kind of makes us take a step back and guess what? It's okay to take care of you,
Mm-hmm.
focus on you. That all that I think it's all encompassing, especially because I work with women, so that's why I talk about women all the time. But
Yeah.
that's I think that's huge is to learn what you need to do and take the steps and do the things instead of just taking a pill.
Yeah, and I think we're so inquisitive usually as women anyway, and even HRT is sometimes, in my opinion, given way too quickly without kind of figuring out, okay, sure, your hormones are low, but why? Why are they low? Okay, you could say menopause, but yeah, but so why are you having so many symptoms where somebody like me can not have any symptoms, where my mom had terrible menopause, right? So I think when we educate women that and stop focusing on perimenopause and menopause being just this drag and this horrible time of life and oh, it's just terrible and yeah, there's definitely changes, but to take your attitude and go, I want to learn more about my body. I want to see what I can do, what kind of hacks that I can do to help to improve this. That's telling me more about myself. I'm learning much more about myself. And instead, we take hormones that then, if we don't look at those metabolites, like I mentioned before, they can actually cause more problems in 6 months to a year if they're not being monitored optimally. And I'm not against hormones. I take some myself as well, and I just do it in a very precise, small way to keep myself feeling well. And that was my last resort. I did,
Yep.
decades of doing stuff before that until I was like, okay, I do really think I need a little bit of extra help here. But again, small amount, and everybody's different. Some people can't take hormones, right?
Yep.
So and there's tons of natural solutions as well too to help people with their symptoms as well. So yeah, I love the way that you're looking at yourself and your body as I'm learning, right? This is different. Maybe it's not maybe I would still prefer to eat the stuff that I used to eat, but I'm learning more about myself. I can figure it out and I get excited when I do figure it out, right? That makes
Yeah.
it cool. Like I did this, I did this for myself.
Yeah. And I think that's important too. Like, I always tell my clients to work with them, I'm going to teach you how to do this. I won't tell you what to do because then you're really not learning. I'm not educating you. I'm just saying, do this. And I guess this is my background. I'm like, I want to know why. Why are you telling me to do that? Why are you telling me to take that? Why are you telling me to move like that? What
Yes.
is it going to do for me? Because
Mhm.
again, then we learn and we have the knowledge. We can also share with other people then too, right?
Yep.
It's not just about us.
Yeah. And I think that it sounds like you and I are on the same page. I love learning about my body and I love, all the different things that come up. Yep, some are total inconveniences, but it still motivates me and it's a challenge. But there are people who are just like, just tell me what to do.
Yeah.
Just tell me what to do. I want to do it. I'll do that. But then here's the thing. I say, okay, this is what we'd like you to do. And they're like, I don't know if I could do that.
Yeah.
I'm like, well, wait a minute. You just told me that this was the worst pain of your life. And, you really want to do anything that you can. Then we talk about food sensitivities and we do a test and you've got to get rid of just a couple things for just 3 months, not forever. And you're like, I don't think I can do it. I'm like, wow, that's telling, So we really have to kind of change the outlook that we have around pain and food and, enjoyment, related to food, stuff like that, that sometimes we need to break those patterns in order to help ourselves.
Yeah. Yeah. I agree. Yeah. And be willing to try something.
Mm-hmm. Exactly.
'Cause I always say, because this is again, I tell my clients, if you want to live 20, 30, 40, 50 years from now, you got to make changes. Otherwise you're going to just feel miserable for a long time. And that's not really kind of life that I want to live. So
Exactly.
yeah.
Exactly.
Yeah. Yeah. Awesome. Oh, this has been awesome. Great. Is there anything else that you care to share that we didn't talk about that maybe you want to talk about?
I think just generally anybody who's experiencing pain out there, I like to say pain does not have to be a life sentence. If it can wear you down, absolutely. So keep looking for help. There can be help out there, and trust and verify, right? We're not telling you to do everything and all the things, it has to feel good to you about what's being put forth for you. But, also be open and willing to, try new things. And again, after you've done your research and feel good about it, and not just throwing your money at everything. But it doesn't have to be a life sentence, and there are answers out there for you. And if you look at your body holistically, and really address the points that we are talking about today: gut health, food sensitivities, hormone optimization, movement, and get people to help you, build a team around you to help you. There's a fantastic chance that you can really feel 1,000% better than what you're feeling right now.
Yeah, I love that. And I do love that there's so many more doctors, chiropractors, everybody's more willing to work together than they used to be years ago. It was like, nope, I do this and I'm not going to refer anybody. So
Right.
there's so many encompassing teams out there now that are definitely going to help for sure.
Absolutely.
You just got to find them.
Right. Yeah.
Yeah.
Yeah, exactly. The nice thing is we have so much information, but the hard thing is we have so much information, right?
Right.
So,
Right.
we're lucky, and then it's frustrating because we got to sift through a lot.
Yep. Yep. For sure. Awesome. So can you share like where people can find you, how they can find the book, connect with you if they have any other questions?
Sure, absolutely. So the book is on Amazon, The Pain-Free Formula, Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections on Amazon. I also have a podcast called The Pain-Free Podcast. So I expand on some of the ideas that we talked about in the book. And then my clinic is in Milwaukee, Wisconsin. We also do telehealth visits as well. And that's NEWYOU, healthandwellness.com. So you can always reach out to us through the website. And if you register for our newsletter, we've got some free ebooks that talk about hormones, that talk about gut health, that talk about movement, that can help you as well. Expands on what's in the book as well too.
I love that. I'm gonna be checking all those out, and I'm also, yeah, I will put all that in the show notes as well. So anybody wants to check them out and see what you're all about and check out all the information, they can find it there. So, thank you so much for sharing your expertise with us today. I appreciate it. And for anybody that's listening, if you're struggling with joint pain and wondering if it's food or what's going on with your body, just try some of these things that we talked about. Check out some of our information, and again, stop and listen to your body. Your body's giving you information. You just need to pay attention and be willing to give things a try. Yeah. So awesome. Thanks again, Stacey. I appreciate you for taking the time out to share this with us.
Oh, thank you for having me. It was great. I really enjoyed our talk.
Yes. Thank you so much. And to my listeners, I will see you next week, and goodbye. Thanks for tuning in. If today's episode hit home, make sure to subscribe to the show and share it with a friend who needs it too. And if you're ready for more support, come hang out with us in the Fit Chicks and Hormones community. The link is in the show notes. And until next time, keep showing up for yourself. You deserve it.